Good evening. You're watching the main news on HKIBC. I'm Isabel Wong.
And I'm Edna. Here's a look at tonight's top stories. Not so sweet budget revealed by Financial Secretary Paul Chan today.
Public health sector gets massive cash injection by government to address manpower shortage.
And budget surplus nearly 3 times less than last year.
Financial Secretary Paul Chan unveiled his budget for 2019 to 2020 today, which included $150 billion worth of initiatives.
Many people listened carefully for any sweetness he would give out, but the ones that he did were smaller than before, due to a much smaller government surplus. The cover of this year's budget speech was light green in colour. Chan explained earlier that the colour choice represented Hong Kong facing economic uncertainties, and hard work was needed to make a good harvest from the fertile soil. The finance chief announced today that the fiscal surplus would drop to $58.7 billion from $149 billion last year. Chief Executive Carrie Lam said the budget proved that the government was willing to invest in the city's future. But critics said it lacked vision and creativity. We begin with HKIBC's Riley Chan taking a look at the sweetness that were revealed by the Financial Secretary.
Paul Chan's budget had the usual sweeteners in it this year, but they were not as sweet as before. Around 1.91 million taxpayers will benefit from a 75% reduction in salaries tax, the same as last year. But the ceiling will be lowered from $30,000 to $20,000. This will reduce tax revenue by $17 billion. Property owners will have rates waived for all 4 quarters, with a ceiling of $1,500 per quarter. The measure is expected to benefit 3.29 million properties at a cost of $15 billion to the government. Business owners will also receive a 75% profits tax refund capped at $20,000. Business registration fees will also be waived for some 1.4 million business operators, reducing government revenue by $2.9 billion. Last year, Social Security recipients got an extra 2 months of allowance on top of other relief measures targeting the grassroots. But given this year's much smaller fiscal surplus, recipients of Comprehensive Social Security Assistance, Old Age Allowance, Old Age Living Allowance, Working Family Allowance, Work Incentive Transport Subsidy, and the Disability Allowance will only receive 1 extra month's subsidy. The move will cost the government $4 billion. The financial chief was asked whether Hong Kongers should expect smaller sweeteners in future budgets. Chan said he did not want to speculate.
Whether in the future sweeteners will be getting smaller and smaller, that I'm not sure. That really depends on also our financial position at that time. Depending on economic situation, the forecast surplus of the government in the coming years seems to be not as big as before.
An additional $1,000 worth of elderly healthcare vouchers will be provided, and the accumulation limit will be raised from $5,000 to $8,000. That will cut government revenue by over $1 billion. While F3 sweeteners seems to have shrunk this year, one got a boost. Chan said the government would provide each student in need a one-off grant of $2,500 to support learning, up $500 from last year. It will also continue to pay examination fees for all students sitting the 2020 DSE exam. Chan believed the $150 billion worth of initiatives and funding announced in this year's budget will support enterprises, safeguard jobs, stabilize the economy, and strengthen livelihoods. Riley Chan, HKIBC.
The public healthcare sector will get a massive cash injection to address the manpower shortage crisis.
Finance Minister Paul Chan will be pumping in $80.6 billion, a 10.9% increase from last year. Karen Young reports.
The recent winter flu surge put enormous pressure on public hospital workers, which sparked rare protests. The rush of patients, coupled with a manpower shortage and aging facilities, pushed frontline healthcare staff to the brink. This spurred Financial Secretary Paul Chan to announce a massive expenditure of $80.6 billion on public healthcare services in 2019 to 2020 in his budget today. This represented a 10.9% increase from last year and accounted for 18.3% of the total recurrent expenditure. The Hospital Authority will be allocated $68.8 billion, about 8% more than last year. Over $700 million is earmarked for retaining staff in public hospitals. The money will be used to increase the allowance, which encourages healthcare staff to work extra hours. More senior nurse and allied health professional posts will be opened to enhance services. One of the highlights of the finance chief's budget was the new $10 billion Public Healthcare Stabilization Fund. The new fund will be used to prepare for any additional spending by the Hospital Authority in case of unexpected circumstances. There was also good news for patients suffering from rare diseases. An additional $400 million will be provided to the authority to introduce more drugs to public hospitals. The authority's total expenditure on drugs will add up to $6 billion per year. Together with new measures to relax the means test mechanism of existing subsidy schemes, the financial burden on patients' families would be alleviated, Chen said. The authority spends about $1 billion each year to upgrade or buy medical equipment. This year, the government is allocating an extra $5 billion towards that. In a statement, the Hospital Authority expressed its gratitude to the substantial increase in funding and vowed to improve working environments and patient services. However, Health Sector lawmaker Joseph Lee doubted the authority could make good use of the money. Past experiences showed the authority would sit on the funding and drag its feet. Frontline staff would not feel the generous